Hello, welcome. My name is Jenny, and I am a Kaplan instructor here with you tonight to answer questions. So, I am looking forward to having this conversation with you tonight and interact and have a chance to talk with you and answer the questions you might have where you have some concerns or questions about NCLEX. So we're glad to have you. Like I said, my name is Jenny, and I am broadcasting from North Carolina. My light's a little odd here. Hang on, let me fix that a little bit so you can see me. So I'm broadcasting from North Carolina. I actually was born and raised in North Carolina, but my husband is active duty military, so we've been all over. But I have been a nurse for 22 years. I started in labor and delivery, moved on to endoscopy, hospice, blood banking, pediatrics, a little of everything when you move all over different places. But I have been teaching for 12 years. I've been an instructor for 12 years, different places, and I have been a Kaplan instructor for 3 years. I teach RN classes, I teach PN classes, I teach classes where I see you in person, and I teach classes where I see you online. So I am glad to be here tonight. I'm not sure what they called it. Excuse me for not looking. I just finished teaching a class and came over so I could do this tonight. But it's pretty much like office hours. I'm just in my office, and actually I am in my office. I'm in my office, and I'm here to answer your questions. So you have a question about Kaplan, I am here to answer and answer those for you if there's something that I can do. So you let me know, okay? Yeah, you got ways you want to beat this test, you let us know, because that's what we're here for tonight, to answer any questions you have. I'll just give you a couple of questions that I have. Students say to me, Jenny, how do I study pharmacology? That is just a rough area for me. Well, a couple things I can give you hints about is that you're only going to see generic medications. You're only going to see generic. So you're going to see acetaminophen. You won't see Tylenol. So that may be the first problem. You've got to learn your generic meds. The second thing I say to do is learn medications by these 3 ways. Learn the classification. Is it an antihypertensive? Is it an anti-seizure med? Got to learn about that. Then learn by the families. What families are there? They're beta blockers, they're ACE inhibitors. Then learn side effects and pay real close attention to the safety side effects. Because the NCSBN, those are the people who make NCLEX, they actually are all looking at, can you be a safe, effective nurse? So you want safety, safety, safety to be sitting on your mind at all times so that you can answer those questions appropriately. Anybody got any questions for me tonight? Because you don't want me to just sit here and talk all day. I felt like I've done that all day. But I'm here to answer any questions you had. Any myths you've had? Or have anybody of you taken the test before and weren't successful and have some questions about that? Kaplan has plenty of resources. Oh gosh, we have so many resources. A lot of them are events that we have in the evening, so you can come and watch those. Google up Kaplan, or you can see on our Facebook page different events that we have. Like for instance, some of you are here because you heard that I was going to be here answering questions tonight. Let's see what else we can talk about today. Let's see. Oh, okay, so I'm in the midst of teaching a class right now. So I'm teaching an RN class. And one of the questions that a student didn't realize is that part of my job at NCLEX Hospital, okay, because here's the deal. NCLEX is its own world. It's its own hospital. So when we go and visit that world, we have to know the rules, the laws, the culture, the currency. And one of the rules that happens at NCLEX is that we don't confront anybody. I know, we do it in real life, right? We say, excuse me, you shouldn't be doing this, you shouldn't be doing that. Yeah? But guess what? We don't confront anybody. Our job is just to take care of patients. Yeah, our job is to take care of patients. And the rest of that stuff, we're going to leave to our nurse manager. We're going to leave that to our nurse manager. Now somebody asks, Rima asked, could you please provide some tips to prepare for NCLEX? Well, one of the things I want to help you with that is that NCLEX is more than just content. Now, we have to have content because content's the foundation of questions. It's the foundation. You got to start there. But you got to also have critical thinking. And the really cool thing about Kaplan is we have this critical thinking tool called the decision tree that helps you approach a question, break it down, and eliminate answer options. So it's a great way and a place to get your information so you know when I get to a question, okay, I know the content, but a lot of times, Jenny, I know the content and there are 2 good answer options. Well, we have wonderful ways to help you break it down. How can a student maneuver med-surg? Med-surg covers a lot of information, doesn't it? Covers a lot of information. So you definitely want to look at some of the big disease processes. So if you start thinking about your body, you think disease processes. All right, so think about the head. Depression, okay, anxiety, that area. Then let's move down. Heart medications, heart problems, hypertension, lipid problems, cholesterol problems, all that sort of falls under med-surg, doesn't it? Let's keep going further. GI system, Crohn's disease, irritable bowel syndrome, all of that in that area, right? And different procedures that you need to know. Different procedures that you need to know because you need to know complications with those procedures, concerns, risks that are probably involved, okay? Keep going. Long fractures. Fractures are a big thing on NCLEX. Strokes are a big thing on NCLEX. Diabetes is a big thing on NCLEX. Pretty much a lot of that stuff you learned in nursing school, it's going to be so helpful. It'll come back to you. Maybe some of your clinical experiences will be helpful. Now, I say that, but I want you to listen real carefully. Because the NCLEX is a national exam, and it doesn't matter where you live to take it, and they don't really care what state you're in and what hospital you work at, NCLEX answers are going to be textbook answers every single time, just textbook answers. So it's not really what your hospital does or what your hospital doesn't do or what you can do versus what the nursing assistant can do. It's all about the rules of NCLEX. And it's hard to take the NCLEX if you don't know the rules of that land, right? Somebody else asked, select all that apply. Wow, Jenny, how do I prepare for them? Select all that apply questions are becoming more prominent on the NCLEX. They're getting more and more. And Kaplan, if you join one of our Kaplan classes, has offered lots of resources for that. They've added more select all that apply to their types of questions so that you can get better at them. Select all that apply. Now be careful. Select all that apply questions can be written above the passing line, hard level questions that we need to get right so that we stay above that passing line and we pass. But select all that applies can be written at lower levels also. So just because you're getting more doesn't mean you're not passing or you are passing. Select all that apply questions, in my opinion, can be broken down either to a yes/no or a true/false. That's how that's how select all that apply questions can be broken down. So approach them and look at each answer option and say, yes, I would be concerned. No, I wouldn't be concerned. Or if the question asks, how do you know that teaching is effective? Yes, teaching has been effective. No, teaching hasn't been effective. Either way, it will work to yes, no these questions. I will give you a hint. Select all that apply questions are hard, and here's why. Because they require to have a lot of content knowledge plus critical thinking. A lot of content knowledge on a lot of different areas because they may give you a question that has 6 disease processes, and all these disease processes you have to decide, are they risk factors? And so you got to know all of them. So that's where it requires a lot of content. My best suggestion is keep practicing on those select all that applies. The more you get, the better you'll get at it. We have a question that says, how early should you start studying for the NCLEX before graduating? This is my personal opinion. You're asking, I'm telling. I would focus on graduating before I would focus on NCLEX. I would get through my exams and I would focus on what my school is requiring me to do. Then I would work on studying for the NCLEX. I personally say that anywhere from 4 to 6 weeks after, this is not a Kaplan, this is just Jenny, 4 to 6 weeks after you graduate is a good time to take your NCLEX. 4 to 6 weeks, because you still need to do the studying. You still need to learn the critical thinking. You still need to brush up on content that you don't know. And I'm really worried about that if you're trying to do that while you're trying to take exams and graduate. That's your number one. You got to get that, because you know you can't sit for the NCLEX without it. So let's make sure we graduate. We feel that wonderful moment of how exciting and how proud you are of yourself because you've worked hard. Okay, you've worked hard. But then I'd hit the books on how do I study? How do I study? What's the best way to study? What do I need to study? All those are really good questions, and Kaplan answers those for you. We do in my classes, yeah, in all of our classes. Now, Kaplan, if you take a Kaplan course, gives you 3 months. 3 months of Kaplan resources you have access to. So that's pretty much telling you in 3 months you need to be taking your NCLEX, because if you don't use it, you lose it, right? If you don't use it, you lose it. And we don't want you to lose that information. So we want you to take it, Kaplan wants you to take it within 3 months. I think 6 weeks is a great time. It gives you time to remediate. That gives you time to review. That gives you time to figure out strategies and take questions and the best way to learn those questions. Okay? Another thing that I've had that students have asked me before is, I don't know quite how to study and what to study for. Now I'll be honest, there are plenty of resources out there. There are tons of books. There's companies that, just like Kaplan, what you want to do is find a company that works for you. Do they have a guarantee? Do they have, is their setup, is the way they help you study the same way the NCLEX is, right? Because we don't want to be learning the way that the NCLEX is not going to be testing us on. One way you can do that is NCSBN, National Council of State Boards of Nursing. That is the people who make the NCLEX. Yeah, they make the NCLEX. So I want to know what they have to say. You can go to that website, ncsbn.org, and you can look up frequently asked questions. Frequently asked questions, so you can find out what they're testing on. What are the very important information that I need to know? What do I have to be able to sit down and take the test? I mean, what do I have to bring with me? What identification? What credentials do I have to have so that I can take this test? So those are some good things that you might want to look at. If you are repeating the NCLEX and you are not successful the first time, second time, third time, whatever time it is, Kaplan has a wonderful event called Repeater Testtakers. And you can find that on our Kaplan website or on the Facebook page. And if that's you, that's fine. You know what? We can't change the past, but boy, we can change the future. We can see what we need to do so that we can work on being successful. What Kaplan books would you suggest for Canadian NCLEX exam to study over summer break? Well, we have a couple of books that I would suggest. Kaplan has a book called the NCLEX RN Content Review Guide. The NCLEX RN Content Review Guide, and you can get it on Amazon. All right, you get the electronic book if you join our Kaplan course, but anybody can buy it on Amazon. It's a good book. It shows the first 2 chapters pretty much show how the NCLEX is broken down, so that's helpful. And then it goes through content. Chapters 3 through the end are all about some brushing up on content. Now, I will admit, the book is thick, but it's the Cliff Notes of nursing school. Keep that in mind. I'm not asking you to read hundreds of books like you did in nursing school. The Content Review Guide is a really good book. There's another book called The Basics, the NCLEX Basics Kaplan book. It's another book, and it's very heavy on content. So if you feel like, oh, I feel like I'm behind on content, or this, I've been out of school for a while, and I know I have lost some content, that's another good book. You know, and tell yourself, I'm going to read a chapter a week, or I'm going to read 10 pages a day. I mean, give yourself a goal, set your goal. Life happens, but set your goal and review that information so that that foundation, that content is strong. But I'll say again, just knowing content, I think that's probably one of the biggest, pitfalls. Students go, well, I graduated from nursing school, so I should be able to pass the NCLEX. That's not how it happens anymore. It doesn't. You have to take content and then you have to apply it using critical thinking. And so why you do that is because we're going to do critical. Think about this. Our patients are sicker than they were when I graduated. We've got so many new advanced practices, much more technology. We have learned so many things that we used to do that we shouldn't do anymore. We've learned new things that we didn't know. All this evidence-based practice is constantly changing. And with that, that means things are changing. So yes, I need the content. But a lot of times, even in nursing school, you know what I'm talking about, there's 2 good answer options. Well, how in the world do I break that down? Kaplan's got some great strategies. Great strategies. Okay, I've got to eliminate answer options. That's the key. I have to eliminate, okay, this one would not be good for my patient. This one doesn't even make sense for my patient. And get rid of it so that I get down to 2 really good answers. And then when I look at the answers, I go, all right, Kaplan, I know you. Let's see, which one's really related to my topic? Well, this one's not really related to topic. You just threw it in there to distract me. Because they do that. They're good. They know nursing students. They know how nursing students answer questions. I mean, I give them that, right? So I have to pay attention and go, okay, which one's more related to my topic? The other thing I ask myself if I have 2 good questions or 2 good answer options, which one is safer? Because the NCSBN is looking at nothing but safety of the public. I want to safeguard the public. How do I do that? How do I do that? The best way to do that is to look at which one is the safest answer option. So you asked about those books, the NCLEX Content Review Guide and the Basics book. Both of those can be purchased on Amazon. You can purchase those. That's a good way to get started on your studying. Okay? Best way I can think of to get started on your studying. And you know what areas you're not so hot at. When I graduated nursing school, I loved OB. I ended up being an OB nurse for the first 6 years. Okay? You are so kind. Somebody says they had me in class. I'm so glad to see your face. Kaplan questions over and over again, especially if you're getting wrong. I'm trying to read the question. I'm sorry. Okay, I'm not quite sure your question because I can't read it very well, but let me tell you about this. When students learn this new way of thinking that we teach you in Kaplan, it's called the decision tree. It's a way of critically thinking. I have to admit students get a little frustrated because they try it and they go, I don't like it. I don't like it. Well, it's new. Of course you don't like it, and you're going to push back. But I'm here to tell you it works. I kid you not. On Monday, not this Monday, last Monday, I got a email from a student. The student had taken the NCLEX 3 times and had been unsuccessful, and then she took Kaplan, and she was in my class. She emailed me a lot, which is great. And she said, I don't want to use this tree. It seems like it slows me down. I don't feel like I get as many right, but you said it would work, and so I'm going to believe you. She passed, and she emailed me back, and she said, tell all your students to do it the Kaplan way. And I said, I will do my best, but whether they'll listen is a whole nother story. Kaplan is good at what they do. Kaplan has been around teaching nursing students for 35 years. They got this down to a fine art, and they're constantly tweaking it, making it better and better. And it does require you to do a hard work. It does, and sometimes you feel like you're doing worse, but that's part of the process because you're learning the process. You're learning to understand the process. You go back to what's comfortable. That's what we do when we get nervous or frustrated or mad. We go back to what's comfortable. So over a 4-day period, I try, and other instructors try, to make this thing that we're teaching you comfortable so that when you get anxious and when you get angry and when you get frustrated, you fall on back on what's comfortable and it'll work for you. Okay? All right, good. Ned, she's saying that she used Kaplan throughout my program and took the NCLEX once. Okay? So can you give us any examples of what you wish you would have done differently? Would you be willing to share any of that? I'll share some why if anybody else wants to. And the reason I share it, because students email me all the time. I get hundreds of emails from students, which is great because I love to hear from you because I want you to be successful. I'm determined that you are going to be my colleague and I want you to be successful. And to do that, I'll help you in any way I can. A couple of things that I've noticed students say over and over. I read questions too fast. I don't know. This is funny. I just so happen to have this sitting next to me. I teach with a magnifying glass, and the reason I do is because I remind students that we are word detectives. We have to pay attention to every word. Words like immediately, all, extremely, never. I'm not saying those words are right or wrong. I'm saying I need to be a word detective and pay attention to them. Because is all appropriate in this question? Is immediately appropriate in this question? I don't know. But if I'm reading it so fast because I'm worried about time, time is your enemy. Time makes you mess up. Think about a Monday morning when you're late. What happens? Oh, let me tell you what happens to me. I lose my keys. I have 2 different shoes on. And I'm even more late than when I started. Okay? So we have to work on reading questions slowly and picking out every word that might go, let me think about this. And I point out words. I point out words a lot. I pointed out them today. I pulled up that magnifying glass near my class and I said, hey, I see immediately. What should we do? Let's stop and think about it. Because I want you to understand something. The NCLEX is not a black and white test. Therefore, we cannot give you black and white rules. That's putting blinders on you. We don't want to put blinders on you. We want you to think. And so, but I can give you words I want you to go, wait a minute, stop, pay attention to it. Words like restless. What could that word mean? If I'm restless, could it be I'm anxious? Sure. Restless. Could it be I'm restless because I can't get any air in? And I'm an asthmatic, so restless, I can tell you, I've used that word many times. So that word is another word I point out to students, just be aware of. It doesn't always mean there's an airway problem, but it could be, depending on what else I have in my topic. The other thing that students tell me is that they get going and then they forget what the topic is. And I think we've all done this in nursing school. Oh my gosh, I can remember it. I'd go back to review and I'd go, I didn't even read that. What was I thinking? Where was my brain? Okay. Angelo, I'm so glad you said that. I passed with Kaplan. It really helps breaking down the NCLEX. Yeah, we help you kick some butt, don't we? We're pretty proud of that. But you got to follow what we ask you to do, all right? And we do ask you to do a lot. I'll be very honest. We have over 2,000 questions that I definitely want you to do all of them. And not only do I want you to take the test, how rude am I? I want you to review the test. Because where you are doing the reviewing is where the learning occurs. Learning doesn't happen while you're taking a test. Think about this. Everybody listen. If I thought that testing was where learning happens, then when I taught nursing school, I would not have any clinicals. I would not do any labs. And I sure wouldn't stand up and teach class. Because that's not where learning happens. Learning happens during the testing. Learning doesn't happen during the testing. No. Learning happens after you take the test and you go back and look at it and go, oh my gosh, what was I thinking? Oh, I totally didn't see the topic. I had all this extra stuff, which NCLEX is really good at putting in what I call fluff or distractors. They put in fluff or distractors, and all of a sudden I just started paying attention to that. And I didn't pay attention to the real problem was bleeding. And so we help you break it down so you can find the topic. And that when you're remediating your questions, that's where the learning happens. Or, oh my gosh, I don't know what Myasthenia Gravis is. Wow, I should probably go look that up. And I would pull out my content book from Kaplan, and I would go in the back and find Myasthenia Gravis. Or if you're in one of the classes and you have the ebook, you put it in the search engine, Myasthenia Gravis, and it pops up. That way, I can do some studying, and I can make sure I'm strong in my content. Therefore, when I get to a question, I know enough content, I got to add the critical thinking, and I can eliminate answer options and find the correct answer. That's the cool thing about, I did not take Kaplan when I graduated nursing school. I just didn't. okay? Oh, I didn't. I didn't know anything about it, to tell you the truth. But when I learned and became an instructor, I was amazed. I was like, oh my gosh, I wish I had been teaching this forever. This is cool. Let me tell you how cool I think it is. I'm being honest. Obviously, I work for Kaplan, so I think it's cool. I think it is so cool that I pulled my best friend, who was my mentor when I first started 12 years ago. I just pulled her out of retirement, and she teaches her first class next month. That's how much I believe in it. They didn't pay me for that one. I'm just here to tell you. Exactly. It is. Would you recommend Kaplan online course to a graduate who will be writing NCLEX in Canada? Yes, the NCLEX exam is going to be the same. So Warren, when you go to the NCSBN, the website that I've talked about, the National Council of both State Boards of Nursing, if you go to that website, there's a whole section about Canadian students and the differences in the test. Such as the different values. It's an awesome way to make sure that you have all the information that you need and you're well informed to sit for the NCLEX. Yeah, I think it's a great idea. Absolutely, I do recommend it. Yeah, I yanked her right out of it. Pulled her out of her retirement, made her sit in my office right here and watch me teach classes. Made her go with me overnight to some places and watch classes. And she was, after teaching for 35 years, she thought this way was pretty awesome. And a lot of students say, I wish I'd had this in nursing school. Well, here's the problem. You weren't ready for it. You weren't ready for it. When you build a house, you have to have the foundation first. You gotta get that content in. Well, now you have enough content. Yeah, we all need to brush up on content. I'll give you that. Brush up on some content. Add that critical thinking tool that we have for you, and you'll be amazed. You'll walk out there with a big smile on your face and 2 lovely letters behind your name. I promise. If you do it the way we ask you to do it, you will be successful. You will be successful. So like I said, there are 2 books. Actually, Kaplan has a few other resources. Students have been telling us for years and years that they have a hard time with pharmacology. Well, Kaplan has a pharmacology book. It's the top 300 meds you need to know for the NCLEX. It's a little small book, okay, about that big. It's not that big. Put it in your purse, ladies. Gentlemen, it's a little bit bigger than your back pocket, but you could put it there if you wanted to. You could tear out. So that's another resource. Another resource we have for pharmacology, because students keep saying we need more, is that we have a Google Play or an app that's called Kaplan flashcards. I had to think about what it was because I just talked about it today in class. The Kaplan flashcards. And they're literally flashcards like you had in nursing school to help you memorize meds. Because yeah, you're going to still have to memorize meds. But you know what the cool thing about meds are? A lot of times they have the same last name. Have you noticed that? They have the same last name. So you don't have to remember med after med after med. You just need to know the same last name. Like Collins. All the Collinses do this. Sometimes there's one odd man out, just like in your family. Yeah. You got one odd man out in your family. If you're not sure who that is, I'm not going to tell you. It might be you, okay? But it helps you memorize those drugs easier, so you can just memorize the bottom name, okay? Are there more pictures now? Do you mean pictures in our videos? Or pictures in our book? Not sure, Nedge, I'm sorry, I'm not sure what you mean. Are there more pictures now? I know that we have 322 content videos. When you sign up for one of our classes, 322 content videos. They're short and sweet. They are awesome to get you the information. In the books, I don't know that there are a lot of pictures, Nedge, in the books. It's more words. If you're a visual learner, then I definitely would grab those content videos because it's an instructor, just like I'm doing right now, sitting here talking to you, explaining things. So that might be more helpful if just reading a book does not get it. And I get that because sitting down to read my books are not that exciting too. Because I'm currently working for my nurse practitioner degree and I'm in pharmacology, so I feel your pain, okay? So reading hundreds of pages is really painful. So I have to stop, go look up other things, find pictures. I agree with you. Apply it. Think about a patient. I'm constantly emailing some of my friends. Just say, what med are you on? So I can look it up, because then that'll make it stick more when it's real. But learning meds by classifications, families, and safety side effects is a really good way. And remember, in families, they have a lot of the same last name. Yeah. Good. Very good. I love your questions. Keep asking them. Keep asking them. We've talked about the 2 books. We've talked about the pharmacology book. We've talked about the Google app and Google Play and the app that you can download on your phone to get those 300 cards, right? Flashcards. Good. Yes. All right. Samantha needs some advice. Last minute advice. She is at capacity. All right, Samantha, here's what my suggestion would be to you. If you're taking it Thursday, tomorrow is your day off. I want you to get a manicure, a pedicure, a massage, a movie, whatever. You are to chill. You are just to chill. And at this point, it's Tuesday night, and you are so sweet and can come to class, and I appreciate that, listening to me ramble on. But I'm glad you're here, because I'm here to tell you you can do it. You can do it. If you have been using Kaplan and you have done their resources and what they've asked for you, then you can go there with your head held high and say, bring it on. I got you. Now, here's another thing I want you to think about, Samantha. You were going to sit for 6 hours. Just accept it. The longest exam for an RN exam is 6 hours. For the PN exam is 5 hours. If you just go ahead and accept it in your brain that you're going to sit for 6 hours, it won't kill you, okay? Because if you think you're only going to sit for an hour, then can you imagine the second hour and the third hour? Take snacks, take water, put it in your cubby or wherever they let you put it, and take breaks. When you feel like you're losing focus, when you are hungry, when you need to go to the bathroom, don't do the little dance in the seat. Get up and go. Take those breaks. Guys, breaks are highly important. They get oxygen to your brain. Take deep breaths. Look at yourself in the mirror and say, Samantha, girl, you can do this. You've got what it takes to do this. And a break doesn't even have to mean get up from your chair. A break can be close your eyes, do a little meditation, do a little prayer, do a little something to refocus and say, okay, that was a really hard question. I'm having a hard time with that one. Okay. But the next question is a completely different question. It's a different patient. I can do this. That would be my suggestion for you. And rest tomorrow. Have fun tomorrow. Giggle tomorrow. Hang around with people who make you laugh and don't make you anxious. That would be my suggestion for you tonight and tomorrow. And you can do it. Good luck. We're all rooting for you. We need more RNs. We need more LPNs. We need you guys to go take that exam. Tell Kaplan who's boss. Tell Kaplan's who's boss, and then watch, and then go in there and be successful. And that's what we hope for each of you. And that's the point of Kaplan. Okay? That is the point. That is why we do these live events. That is why we do classes online. That's why we do ground classes. That's why we put out pharmacology books, because you asked for it, because you said you wanted it. We hear you. And we want you to be successful, because your success is my success. And so whatever I can do to help you along is what we'll do for you. Okay? Any other questions that I can answer for you tonight and help you along the way? Or any other comments that you would like to share with others so that they can see it? You're welcome, Samantha. Best of luck. Thank you for being here tonight. That was very kind of you. Way to go. Look at Megan is here with us. She says, I took Kaplan, passed the first time. Woo! Way to go. I'm so glad you're here to share that with us. That's awesome. I love hearing those positive feedback from each other. It gives us encouragement. Makes us feel like we can do this. We can do this. It's tough. It's tough. Exactly. We can do this. It's not out of our reach. All right, Meg. Repeat test takers. Here's the deal. The NCLEX doesn't know you're repeating. I want you to first think that. Take a deep breath. They have no idea who you are. They are not out to get you. Okay? They don't know. You're just a number. They don't know who you are. So here's the good thing. Here's some positive. You've seen the test. You've seen the test. You know what it's like. Okay? You know where the timer is. You know where the calculator happens to be. So you know where the significance and how it works. So when you go through that, my question to you is, if you're repeating the test, here's a couple of things, 2 things. Here's the number 1 thing. Most of the time, repeater test takers, they are repeaters for 1 or 2 reasons. This is what I've just learned statistically. They did not know enough content walking into that exam. If that's you, then review content. If you're part of Kaplan, watch all 322 videos and read that entire book at least once. The second thing that I've noticed for repeat test takers is they let anxiety get the best of them. Okay? This is a very mental test, I'll be very honest. Okay? It is a very mental test. So you have to walk in there with confidence. Well, it's really hard for my confidence and anxiety go opposite of each other, right? If I have high confidence, I have low anxiety. If I have high anxiety, I have low confidence. So you have to find out what helps you build confidence. Is it taking deep breaths? Is it doing good on more tests and more tests and more tests so you feel good about yourself? Is it reminding yourself, hey, Meg, I got through nursing school, babe. If I can do that, I can do anything, right? Exactly. You can do it. You can do it. Many students are repeat test takers. It is what it is. You can't change the past. Let it go. Let it go. Now let's focus on the future. Viviana says the decision tree is difficult. It is. It takes a lot of time. Yes, it does. Here's what I tell my students. When you come and learn about the decision tree, it's like taking driver's ed class. It is like sitting in the class and learning how to drive with this tree. This whole new way of thinking. You've never driven before with a tree. So then we teach you the tree, and then we let you go drive on your own. And we've noticed that y'all run into things. Y'all go past the stop signs. You get pulled over by cops. You have a couple of accidents. And that's expected when you do something new. The only way you get good at it, and in North Carolina, you have to be driving for 1 year with your mother or father or guardian. 1 year. I'm not asking you to do 1 year. But that's just so you get good at it and comfortable and safe. So the more you do it, it will become second nature. Think about what you do now. If you've been driving for many years like I have, I can drink something. I can talk to my mom on the phone. And I can listen to the radio. And if there are children in the background that need to be, I don't know, reprimanded, I can lean back there and get them too, right? So I've become really good at multitasking at my driving. You will also with the decision tree. Ned says that the live class helps break down the decision tree, and it does. And for those who still running like into some problems with that decision tree and feel like they're going slow, we have a decision tree video. It's just an instructor. It's pre-recorded of them speaking about it over and over so that you see it slow. And that's pretty much the point of live classes and online classes. So right now I'm in the middle of teaching a class, and I go through questions. I went through 100 questions today. Over and over, repeating myself constantly, okay? So that you see how it's broken down, and I go step 1, step 2, to the point of it's almost annoying, to the point that when students take their first test, like all by themselves, they feel like they're talking Southern because they hear me repeating myself. And that's the point, because you don't have to memorize if I'm talking, do you? If I'm sitting right here on your shoulder, you don't have to memorize a thing. But the decision tree does help break down those hard questions. And when I talk about hard questions, questions are above the passing line. Those are harder level questions, application questions, okay? Analysis type questions, okay? Lower level questions are knowledge questions, comprehension questions. In Kaplan, we don't have time to work with the easy stuff. I want you to get good at the hard questions, the questions you want to get right on NCLEX. So all I did today was 100 questions above the passing line. I just did hard questions all day today. And students are a little uncomfortable because it's only day 2. But towards the end, some of them are going, okay, I see it now. I'm a little scared to do it by myself, which doesn't surprise me. But I don't expect you to be a master at it. What I expect you to do is listen, learn, and keep your mind open, because I'm trying to tell you to stop thinking like a nursing student and think like a nurse, and there's a complete difference, right? There are books. Rima wants to know about the books. Rima, there are books, and of course I'm going to recommend Kaplan books. We have 2 Kaplan books. You don't have to be in a class to take those books. You can get them from Amazon. The one is NCLEX RN Content Review Guide, and then there's a Kaplan Basic book. That's got a lot of content in it. But the NCLEX RN Content Review Guide has how the NCLEX is broken down, ways to study, and content in it. It has both. If you get your 3 months, you're right, Bearless. If you get 3 months of your resources, if your resources run out, my suggestion is to call 1-800-CAP-TEST, 1-800-CAP-TEST, your 1-800 number for Kaplan, and tell them what's going on and that you need an extension. They're pretty much going to give you an extension because they want you to be successful also. Okay? They want you to be successful also. I love these questions. Y'all are doing good. You're doing awesome. I'm hoping I'm answering them for you well enough that you feel more confident and more comfortable and maybe want to come take a class with us. We'd love to have you. Or, you know, we do have some free events that you can go to and listen. There's a test-taking strategies. There's a practice test you could try. All of those are there. There's a repeater test taker class or event that you can watch. All of those are very, very good. There, I believe there was one I was teaching assistant. I wasn't teaching at that one. I was in the background. Was about watching a live class. Like, so part of your event was watching a class so you could see if you liked that, if that was something you felt comfortable with. The nice thing about a live class, live online, is you can stay in your pajamas and drink coffee, and I don't, and listen to the instructor. It's pretty awesome. Or you can, if you know, oh, I'm not as committed as that, I need to actually go like to my school or somewhere and sit down and stay there. We also have those also. And we're getting to that busy season, so there should be plenty available for you to watch and look at. If you will make the phone call, they'll let you know. If somebody's asking about if you want to extend your resources, they'll let you know. But you should be able to extend it without any problems. Yeah, Viviana, usually. We want you to be successful. We want to extend those resources. We know life happens, guys. We get it. People get sick, divorces, separations, house moving. Stuff happens. Family members get sick. We know that. And we want you to still be successful. And sometimes you have to start back again and pick back up where you started, which is fine. We understand that completely. Well, I want to tell you thank you. I appreciate you guys being with me tonight. Look, I've got another question. I'll answer that, and then we're probably going to close for the evening. So if you got any more questions, let me know. I'm more than happy to help them. How long is your recommended review time in months? Okay, I think 4 to 6 weeks. So that would be 1 to 2 months, somewhere around there. 1 to 2 months of studying, probably 5 days a week. I'm not talking 1 day a week. I'm talking 5 days a week. What do you recommend? Read content first or take the exam? All right, here's my suggestion. If you have been out of nursing school for more than 6 months, if you've been out of school for more than 6 months, I suggest you focus on content first, then take test, review, make sure you understand what you got right and got wrong, and then take another test. If you haven't been out of school for 6 months, go ahead and start testing. If you see that you are really weak in areas like, oh my gosh, I knew nothing, then stop and review content. But I don't think you need to start with content, because didn't you just do nursing school? Because that's just content, 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 content. And I definitely want you to know content, but that should still be that should be pretty fresh in your brain. So the content I really, really want you to work on is the content that you don't know a lot of. Let's start with our weak areas first. All right, if you've been out of school for 3 years, I'd say you start with content. We have a content book. We have 322 content videos. I'd start with that. That would take about 60 hours of all of that together. Then start testing, because it's going to get frustrated to test and not do as well as you think. It's because you're going in not knowing content. So if it's been 3 years, I say start studying content first. And Kaplan has 322 content videos with their program. We also have an electronic book with our program. Of course, it's a book you can buy online. That's not a problem. From Amazon if you want to. But those are good ways to start. But more than 6 months, get into the content. Okay, SATAs. I love them. Select all that applies. Now, I want you to think about this. Select all that applies can be written above the passing line, harder level questions, and it can be written below the passing line. If you go to the NCSBN website, this is what they say. And they write the test, so I just look at their website, and they said, SATA questions, select all that apply questions, will be more than one answer option, period. And then they don't say anything else. So could it be all? Yeah. Could it be one? No. Could it be two? Yes. Could it be three? Yes. Could it be four? Yes. Could it be five? Yes. Could it be all of them? Yes. Because that's all they say. That's all they say. They say it will be more than one answer option. And so I have to go by what they say. They write the test. So yes, it could be all answers. Now, another question somebody asked me earlier today is, will I get chosen to take 265? The minimal number of questions for the RN is 75. The minimal number of questions for PN is 85. Okay? So 85 to 205 for PN, 75 to 265 for RN. All right, so that being said, the first time it can turn off is 75 or 85, right? No one is chosen to get 265. No. You have to prove you need that many. At 75, 76, 77 for the RN, if you have proven sufficiently and consistently that you can stay and answer the questions way up here on the harder level questions, then it'll turn off. But if you can't prove that, then it just keeps giving you more questions. So here it is. If you keep getting questions, you are still in the game. You still can be successful. So don't start getting upset. Don't freak out on me. No freaking out aloud, okay? You can freak out after the Kaplan. No freaking out during Kaplan. Then make sure that you know that the earliest time is 75 for RNs and 85 for PNs. That's as soon as it can turn off. Oh, I love seeing where you're from. I told you, somebody else is from North Carolina. You're in the mountains. Glad to see you. Florida. Oh, wow. Kentucky. IA. Mount Pleasant, Idaho. Oh, Idaho. Nice. So glad to see all of you and glad that you're here and joined us this evening. It's pretty awesome. I appreciate you coming because it's hard to give up a whole evening to come and hang out with me for an hour and check out anything else that you might know. Any other questions that I can answer for you? That's what I want to do for you. Any other myths you've heard and go, oh, I wonder if that's true or not. Love to hear what you have to say. Want to make a comment? Want to share something? Oh, from New Jersey and from New York. All right, Lana, you say I got all my answers. Okay, so when you take your NCLEX, okay, when you take your NCLEX and you weren't successful, they send back an analysis, okay? And the analysis says near passing, below passing, and above passing. So near passing means you were close, just not quite there, okay? So you ask yourself, do you think it's because of content? Did you change answers? Is it because if I used the decision tree, I didn't use it correctly? Or I got it down from 2 answers all the time and completely got out of whack and couldn't remember? So yes, you need all those to be above the passing. Now, I will admit, you can pass the NCLEX and not pass every single area. The NCLEX is made up of 8 client area needs, 8. Things like management of care, health promotion, basic care and comfort, pharmacology. Those are some of the areas, okay? They're 8. You can go to the NCSBN website. It's all right there. 8 client area needs. The 3 biggest ones are management of care. You got to be above that one. Pharmacology. You got to be above on that one. Physiological adaptation, mid-surge. Got to be above on that one. But could I be a little weak in maybe 1 or 2 and still pass? Yes, because the test looks at it as the overall picture. It looks at everything, okay? As in general, this is a safe and effective nurse. So if you only had 1 below and all the others above, you passed. But if you have many near the passing line, that's still not passing. So unfortunately, maybe we need to work on content. You were in class with me today. Yes, I'm a little tired, but you know what? It's okay. I enjoy talking about Kaplan. Why are you in class with me and now you're here? Don't tell anybody. You were in class with me all day and here you are listening to more Kaplan. I know you're tired of hearing my voice. You're going to dream Southern, aren't you, Angela? You're going to dream and Southern. I can feel it. Love it. All right, guys, that's going to be it for me tonight. Thank you so much. It really means a lot to me that